Meanwhile, next month, a state panel is expected to consider whether Carilion Clinic can move forward with a proposed kidney transplant program.
Right now, the closest kidney transplant facility is at UVA Health in Charlottesville, a 2-hour drive or more for many patients in the Roanoke and New River valleys. 10 News anchor Samuel King joins us now. So, Samuel, staff is currently recommending that Carilion's program shouldn't move forward.
And Rachel and John, they cited a number of reasons for that recommendation, including opposition from a health system you just mentioned, UVA.
To me, that sounded like a flimsy excuse.
Sidney Vaught is hoping to get a kidney transplant. He's been on home dialysis for 6.5 years now. He was outraged to hear that UVA is opposing Carilion's efforts to establish a kidney transplant program in Roanoke.
I think that is ridiculous, actually. I mean, there's so many people, not just in Roanoke, but in outlying areas. You know, if you're like going further west in Virginia, they have to go even drive further to Charlottesville, you know, than just 2.5 hours.
And that's the heart of the argument here, geography. State standards require that patients be no more than 2 hours away from a kidney transplant center. Right now, there's centers in Norfolk, Richmond, Charlottesville, and Northern Virginia. So that means if you live south and west of this line that starts west of Salem, heads down toward south side, that means you are well outside of that standard. Carilion says its center will help ease that problem, while UVA Health says it has outpatient clinics already in Roanoke, Lynchburg, and Martinsville, with another planned for Marion. And UVA says Carilion's efforts would divert staff and resources from their system, harming patient health in the long run. Vaught is not convinced. When the time comes for a transplant, he not only has to worry about getting to Charlottesville, but also who will care for his 90-year-old mother.
I have a plan that if they call me for a kidney, I have somebody that can come and stay with her, and for the 4 or 5 days I'm in the hospital. But it'd just be so much better if Carilion could start doing kidney transplants and I could get it done here. And I could just whip on over to Roanoke Memorial.
And this is all about access to care, right? You know, I've done reporting on this as well and known people who have needed a kidney transplant who are on dialysis, and a 2-3 hour drive is just too hard.
It takes up a whole day, right?
It does.
And it's got to be hard if you're in a bad way to get in the car and go that far.
Right, and that's a lot of the things that these state regulators are looking at when it comes to that and comes to access. We mentioned the UVA clinics that they have here. Carilion is also proposing to have clinics in Roanoke, Christiansburg, and Galax to help with kidney transplant services if this program is approved. And to read the full report from the Virginia Department of Health, including UVA's opposition to the project, as well as Carilion's Certificate of Need application and more details about proposals, there's a lot of information. We're going to have that at WSLS.com to give people a recap of this ahead of that hearing next month.
All right, thank you so much. I know this is something a lot of people here in our area are passionate about, so we'll continue to keep you updated on this story. Thank you, Samuel.